So in 2013, when local authorities became responsible for public health, taking over from the NHS, we identified that HIV for Greater London was one of the major public health issues that was really challenging. We'd seen increases in HIV diagnoses and incidents for years, actually, since the turn of the century. And there's a really strong sense that we needed to get a grip on this issue, and we need to turn around the upward trend of new diagnoses.
What we've seen with the programme since 2014 is not only halting the increase in infection rates, but actually a real decline. And that's great news for Londoners and a really exciting example of how pooling resources and collaboration between London's boroughs can have a great result for Londoners.
In the 1980s, we didn't have any treatment for HIV specifically, and so the issues around prevention were completely different from after 1996, which is when treatment became widely available. And at that point, it became about life, and the prevention agenda was about life, living well and staying well, because if you were tested, there was something that could be done about it.
There are about 40,000 people living with HIV in London, and we know that a significant number of those are still undiagnosed, which poses a risk to their own health and also to public health for onwards infection. We also know that we have significant levels and numbers of late diagnosed patients. We know around 35% of people in London are diagnosed late. And there's also really high levels of stigma. So we've made that our mission to combat that through a number of programmes, including the London HIV Prevention Programme and its brand, which is known as Do It London.
It is important to know what your status is. Once you know what your status is, then you can get put on treatment. Once you're on treatment, we can get the viral load down. Once your viral load is down, then you become undetectable. Once you are undetectable, you become untransmissible. Therefore, you cannot transmit the virus to your partner sexually.
The quicker you start treatment, if you're positive, the better. Not only for your own long-term health, but because at the very early stages of infection, you're at your most infectious. And so taking a test regularly means that HIV can be picked up at the earliest possible stage, and you can have the best possible chance of a good outcome.
It's great to actually put it into place in the Pride Parade. This is the culmination of our entire year. You know, we're out and about in London every night. We commission them to deliver the outreach and the testing services. If you walk into any gay bar in London any day at the moment, you get the free Do It London condoms and lube.
Today has been absolutely fantastic for us at the Do It London store. We've had thousands of people come to visit us. We've given out thousands of condoms, and people are really curious about the banner and the new campaign. So we've had a really fantastic day.
And I think the good thing is that we're not doctors, we're not nurses, we're gay men who are providing a service. We can talk to them openly and honestly about any concerns they might have. And the test itself is really straightforward. So it can be over in 5 minutes, and then they can go back downstairs, have a pint, and have a good time.
London boroughs are absolutely committed to the future of the HIV Prevention Programme. Not only because we believe that collaboration is producing better results for Londoners, but also we're seeing results in terms of savings to the NHS, in terms of the cost of treatment, because we're keeping more Londoners healthier for longer.
We also work with groups that are at higher risk also, like women and Black, Asian and minority ethnic group. It's important because sometimes some people don't want to go to a sexual health clinic, or they cannot get an appointment at a sexual health clinic. So we go to the community.
We've also seen 28,000 billboard posters of Do It London on the tube and bus network. We've seen 16 million social media views of our short videos which explain all the methods of prevention. We have over 100,000 visitors to the doitlondon.org website every month, and 75 million digital adverts. It's great news that the London HIV Prevention Programme is set to continue at least until the spring of 2022. We actually have no room for complacency around this. We still see that too many people are being diagnosed late, and that stigma still exists, and that incidence is ongoing. We also see that the London HIV Prevention Programme has offered a really good example and model of collaborative work across the boroughs. We've achieved so much through collaboration, things that we wouldn't be able to do if we were doing that as single boroughs alone. And the other thing is that we've made real progress. Since 2015, we've seen rates of HIV drop really significantly in all our key communities. And if we want to get to zero, which is our strategic goal by 2030, it's really important that we maintain those efforts.
London compares really well with the rest of the world in reducing HIV, and it's a tribute to the prevention campaigns, it's a tribute to the NHS treatment and care, which is world class, it's a tribute to the universities and the academics we have in this city, and to Londoners and the voluntary sector and to peer support, and about Londoners looking out for each other and looking after each other.